Hello and welcome. I'm Josh Schimmels, publisher and CEO of the Los Angeles Business Journal. It's a privilege to be here today hosting our 2026 Healthcare Roundtable discussion. Every day, healthcare organizations face a common challenge: delivering exceptional care while meeting the changing needs of patients, families, and communities. Success today requires more than just medical expertise. It means improving access, strengthening partnerships, supporting caregivers, embracing innovation, and creating healthcare systems that are more resilient and more connected than ever before. Today's discussion focuses on the people behind healthcare, the leaders working to improve the patient experience, expand access to care, strengthen community health, and ensure organizations can continue serving those who rely on them the most. Our panel brings together voices from healthcare delivery, patient advocacy, and healthcare law to share how collaboration and long-term planning are helping to shape healthier communities throughout Southern California. Before we jump in, I'd like to thank our sponsors once again for being a part of this. We can't do this without you. ALS Network, City of Hope, Denton's, Emanate Health, Hooper, Lundy, and Bookman, and UCLA Health. Thank you all so much for keeping us healthy and for supporting our community of business. All right, we've got a great conversation and a lot of amazing content to get into, so let's get started. Please join me in welcoming our speakers today. First up, Asher Garfinkel, Vice President of Community Outreach with ALS Network; Kimberly Carey, Partner at Denton's; Roger Sharma, President and CEO, Emanate Health; and today's moderator, Sam Mazel, Partner, Denton's. Sam, I'm going to turn it over to you. Looking forward to a great conversation.
Josh, it's a pleasure to be here and really a pleasure to discuss these important topics with this panel. I'm going to start by asking sort of a broad question for the panel, because just talk about, we're in a time of turmoil in the healthcare industry. Healthcare organizations are balancing patient expectations, financial headwinds, rapid technological change, and really evolving community needs. I'd like to begin by asking each of you to briefly share your outlook for the healthcare industry over the remainder of 2026 and beyond. And then, in the context of that, tell us what gives you the most confidence or the most trepidation about where the healthcare industry is headed. So Kim, let's start with you.
From my perspective, advising healthcare systems across the country, I see an industry that is under tremendous financial pressure, particularly from government payers and other third-party payers. At the same time, we see an industry that is really jumping in to innovative technologies. It seems that the organizations that are going to be most successful over the next year and into the future are those that aren't going to wait for the financial environment to improve. They're really going to redesign how care is delivered to patients. What gives me confidence in the healthcare systems is the investment that we're seeing in AI, the changes we're seeing with the focus on outpatient care, predictive analytics, digital health. Organizations are looking for ways to improve quality while they're dealing with the challenges that they're facing with severe reimbursement pressure and workforce shortages. At the same time, we're seeing patients that are becoming much more involved in their care. They want transparency, they want convenience, they want care that's personalized to them. So organizations that are thinking strategically, they want to do more, and they want to do more than just comply with regulations. They want to build a system that's sustainable into the future. And so I think that the organizations that are going to be successful over the next 5 to 10 years are going to be those that aren't necessarily the largest, but those that have become adaptable to the changes and pressures that we're seeing in the healthcare environment.
Thanks, Kim. That's great. Asher, what's your perspective from you're a nonprofit that works in a specific space in the industry. From your viewpoint, what does it look like going forward?
Yeah, thanks, Sam. If I may, I'm going to start by adding some context to what I'm doing here amongst my esteemed co-panelists here. I want to let our viewers know a little bit about what ALS is, also known as Lou Gehrig's disease. It's a devastating progressive neurodegenerative disease with only a few modestly effective treatments and no cures. And people with ALS lose the ability to move their limbs, talk, swallow, and eventually breathe. Annual healthcare costs for an ALS patient are enormous, and proper care is not always easy to come by. And the benefits landscape is extremely complex and time consuming. And one thing that families impacted by ALS don't have is time, as the average lifespan from diagnosis is 2 to 5 years. So while the ALS network based here in Los Angeles is funding innovative research, we also fund and staff a compassionate clinic and community-based wraparound model of care that's proven to extend and improve lives throughout the ALS journey. And so we exist to help patients navigate ALS care with concierge service and to advocate for improved and expedited access. So essentially, we're helping people live full lives after an ALS diagnosis. And I need to say from the start that while I primarily speak for the ALS community, all neurodegenerative disorders like ALS are really everyone's problem here. Somewhere between 7 and 9 million people in the US are living with a major neurodegenerative disease, and we know that there's a lot of overlap in the science along with the healthcare needs in these communities. So breakthroughs in policies in one neurodegenerative disease will likely benefit many of them. So to answer very quickly your original question, sorry about that side drip there, but we're optimistic because, like Kimberly, we're seeing remarkable advances in science. In ALS alone, we're moving toward precision medicine and gene-targeted therapies, AI-assisted research, and more personalized care. And that's incredibly encouraging. And of course, the challenge here is to make sure that those breakthroughs actually reach the patients.
Thanks, Asher. And it strikes home for me because my brother-in-law passed away from ALS at an unreasonably early age. So Roger, from a different perspective now, I'm really glad we have such different perspectives. We have a lawyer who specializes in the healthcare space, a nonprofit representative, but now Roger, you represent an entity that actually provides hospital care. So what do you see for the rest of the year? What gives you the most confidence or the most trepidation about the healthcare industry going forward?
Samuel, my comments are the hospital industry and the whole healthcare industry had its traditional challenges. They are a very low margin industry, very capital intensive. Labor is the major cost driver, is highly regulated, is highly unionized. There is a ban on corporate practice of medicine in California. So sometimes I joke about it. I don't know how hospitals in California are surviving, but they are. And I'll give you why are they surviving and how do we keep making things work. On top of that, this year, and we are going to be facing for the rest of the year, the implications of the HR1, which affects access and affordability and leads to delayed care. Well, what gives me confidence? One is the need for healthcare services is constantly increasing because of the demographic change. Communities are getting older, their healthcare needs are increasing. So the demand side of the business is still intact. We have to figure out the supply side in traditional economic terms. The second piece is healthcare is local. You can't offshore healthcare to another place. You can for elective, but not necessarily if somebody's having a heart attack. Third is what Kimberly and Asher both mentioned, is the innovation. There's a lot of clinical innovation that is taking place that adds value to the care that we are delivering, and it adds satisfaction to the patients. And in the last 2 years, there's a fantastic digital transformation, whether through AI platforms or other technological advancements. So all these four things give me a lot of confidence. We will figure it out. I'll give you an example. Emirate Health has been serving the community for 200 years between 3 hospitals. So we've survived 200 years. we will survive another 100. We just have to figure it out.
Thanks, Roger. So, but all of you have mentioned, access to AI. I think everyone knows that telemedicine is, particularly since COVID pandemic, taken on a greater importance as rural healthcare entities close with increasing regularity. Telehealth becomes more important. So we're seeing a greater focus on the patient, how the patients are touched by healthcare providers, how they access it, how they navigate it, how they understand it. Certainly, this is going to be viewed over a computer. Everyone has access to the internet now. That can be a mixed blessing for healthcare providers. Asher, from your perspective, what should healthcare organizations be doing today to better serve patients?
The most important thing, especially from the ALS community, is serving patients with a holistic approach. Healthcare can't, especially when you're living with ALS, be kind of a one-off transaction. And the emphasis on streamlined, accessible, multidisciplinary care is all important because multidisciplinary care eliminates the time it would take for a patient to go from specialist to specialist, and it increases access to those specialists all in one place.
Great, thank you. So just building on that thought, we're talking about where's care being delivered. So you're talking about it being more accessible. Kim, where do you see the factors that are driving outpatient care or telemedicine, or how and where care is being delivered to patients?
Yeah, I think that when you're looking at the growth that we've seen in outpatient care, there's several factors that are impacting that. First, economics, they matter. Outpatient care is often significantly less expensive for both the payer and the patient, and the payment policies that we are seeing are increasingly encouraging care in lower cost settings when it's clinically appropriate. Second, technology has changed what's even possible with respect to utilizing other types of care. Procedures that historically required multi-day hospital stays can now safely be performed in ambulatory surgery centers. And last, demographics are changing. The population's aging, more patients have chronic diseases, and many of them just want to receive care closer to home. I think, being able to receive care from your own home with telemedicine became much more prevalent during COVID, and that is something that patients want to continue to be able to experience. So from a legal and strategic perspective, this shift is going to have health systems start to rethink how they deploy their capital. They're not going to just focus exclusively on large inpatient campuses anymore. And we're starting to see much more investment in ambulatory networks, physician integration, digital health, home-based care. So the future is not going to be just delivering care to patients. It's going to be delivering the right care in the right place and at the right cost.
Thanks, Kim. So just building on that description of changing how we deliver healthcare and what will inevitably be changes in how financial assets are deployed, but also the cost structures. Roger, you mentioned the impact of H.R. 1. I think it's safe to say that the cutbacks in Medicaid coverage will have a significant impact on finances across the country, particularly safety net rural hospitals that rely heavily on Medicare, Medicaid. Also, in California, the hospital quality assurance funds, disproportionate share funds that are large sources of revenue for hospitals like your organization. How would you describe the impact of those financial headwinds on the sustainability of your and similarly situated hospitals?
Well, thanks, Samuel. I'll pick up on what Kimberly mentioned. In order to be sustainable, we will have to constantly innovate. And in my previous comment, I did mention hospital industry is a very capital intensive industry. When you start a new program, you need substantial amount of funds. So first issue is, why is sustainability important? For that very reason. High capital investment is needed to transform the organization, and we are going through a phase of transformation. The second part is that sustainability is also important because it means resources at bedside. Sustainability means I will be able to hire a cancer physician who can perform surgeries for cancer patients. Will I have resources to do that? So sustainability is very critical as we are transforming. Now, why is it threatened and how do we solve it? The reason why it is threatened is traditionally, hospital industry always operated on very thin margin. Reason for that was it was a very system in which it was not balanced. Government-funded healthcare never paid at cost. Employer-based health insurance subsidized the government-funded health insurance. Now, as the employer-based health insurance is coming under pressure, the overall revenue streams and funding that is coming to provide healthcare through providers is shrinking. Now, that is a huge challenge. Now, deck on top of this, the impact of HR1 on access and affordability. Now, what it does is indirect. The first consequence when the access is denied is delayed care. The same person who had access to care was coming into ER on a timely basis, now will come when they're really, really sick, which means it's going to cost us much more. Now, how do you solve this? You have to innovate technologically to reduce cost. You have to monitor your cost. You have to make sure that you are break even on Medicare. That's the mantra in our industry. Eventually, if you're looking 20 years from now, you have to figure out how to cut down your costs so that you break even on Medicare. Again, there are some positive things too. There are innovations in care delivery models that can reduce cost. There are innovations in business model that can reduce cost. So we're working on that piece, but sustainability, as I mentioned, is critical. You need to protect margins to protect your community.
You know, I do want to follow up, Roger, with one question about some of the issues you raised, all of which make sense, and I think are pretty prevalent across the space. How are you dealing with labor costs as well? Because we haven't mentioned that yet. You did mention they're heavily unionized, but...
So labor cost is almost 70% of the cost in a hospital setting is labor. Because it's a people-driven business. People provide care and you need to hire people. Our average labor cost for the industry and for Ammonite is rising somewhere between 5.5% and 6% every year. When Medicare and Medi-Cal give us increases over 2 to 3%. So what you have to do is you have to do more with less. The way you solve it is you do not compromise any staffing at bedside, but keep implementing innovations to reduce overhead costs. That's how we are kind of managing. Merger is very important. Consolidating services is very important. Using technology to reduce the cost burden is also important. So labor is a huge element of cost.
Right. And of course, in California, as a hospital operator, you deal with mandatory staffing levels as well, right? Because the state
nursing ratios.
Right.
That's why I joked at the beginning. Ban on corporate practice of medicine, unionized environment, staffing ratios, inflation higher than normal inflation, and government funded, which doesn't pay. So it is a challenging environment.
It is a challenging space. And Asher, you're at a nonprofit that focuses on a specific illness in the space. How are you dealing with the financial sustainability, and also when you look across the space generally, you know, what are you all doing to innovate or work with the the AI and other issues that Kim and others have talked about?
We're looking at all the innovation that is happening within the healthcare industry today, and there are trends and opportunities generated by tech, and what it's doing and can do to bring care closer to where people are. Telehealth, remote monitoring, artificial intelligence, data sharing. We're taking advantage of all of these to bring care to people who couldn't regularly access those components. The ALS network is really, like I say, encouraged by a growing emphasis on multidisciplinary care models, bringing specialists, therapists, social workers, care navigators together for each individual. And I'll say on the research side, there are advances in genetics and biomarkers, precision medicine that are opening new possibilities in early diagnosis and more targeted therapies. And all this innovation helps, as I said, to not only extend life, but also improves quality of life. And, that's what we're about at the ALS Network, helping people live lives to their fullest while progressing through a diagnosis.
And I would think in your specific space, AI and the ability to use artificial intelligence to foster the research would be hugely important right now.
Yeah, we are extremely encouraged about the developments in AI because it's going to speed up research and collection and compilation of data and really enrollees. The collection of people to enroll in clinical trials considerably. So whereas we were conceding to the fact or resigned to the fact that it could take 5 to 10 years for a whole clinical trial to go through, we're talking about maybe a year or two now because of the promises that come with AI.
Great. Well, it's encouraging. So Kim, building on what everybody said, I mean, we're now seeing Roger talked about the financial headwinds facing the industry, the need to be sustainable. Asher and Roger both talked about, the need to be innovative in this space. What steps should a healthcare entity be taking today to better prepare for future changes, future crises, future financial headwinds?
Thanks, Sam. I think, as Roger was saying, there's a lot of analysis that needs to be done with respect to where money is being spent and the revenue streams. And I think that AI is helpful for that. I think one of the other things that health systems need to be prepared for is another type of pandemic or other type of future crisis, such as, cybersecurity attack or anything that they may not even have thought of at this point. And I think one of the things that healthcare systems learned during COVID was they now have this incredible amount of data that they can use to be able to run predictive analytics and use AI in order to run models to see how to best prepare themselves for the future. All of that data can be analyzed to help with determining future staffing, helping with shortages, if there's going to be supply chain disruptions, how to really allocate resources to make sure that the systems and the providers are prepared before the next crisis occurs. And I think from a governance perspective, and the advice that I give boards that I work with, is that they should be asking management today, what if another pandemic or another crisis occurs? What are we going to do differently than we did in 2020? These are the hard questions. These are the types of questions that bring about change, that make people uncomfortable and think outside of the box and how to take those next steps to make things different. And so these conversations should be happening with the board, with leadership. These are going to prepare for the future, and they're going to help to give organizations a competitive advantage, because the best way to deal with all of this is to be resilient and to be able to, adapt to the changing environment and then continue to serve their communities like they want to do.
Thanks, Kim. So Roger, Kim talked about responding to future emergencies like another pandemic. You talked about financial difficulties the industry's facing. So what changes do hospitals, health systems have to make now to remain relevant today, but also to prepare for and meet the evolving needs of their communities?
So, Samuel, I may take a little bit more time on this question because it's such an important question. So there is a script for success. We are a community hospital which serves almost 1 million people. And the script for hospitals or healthcare delivery providers to succeed is no different than any other business to succeed. The first point is start with understanding the needs of the community that you serve. My community is rapidly aging. And guess what we did? We invested in cancer program. We invested in neuroscience program. We invested in orthopedic program. We invested in structural heart program. So understanding the needs of the community solves the demand side. Once you build a program, you don't have to look for patients. It's very much tied to sustainability. You have to be very smart about deploying your investment. The second piece is this industry is going through a major transformation. So what kind of talent do you look for? Do you look for people who can run a hospital, or you look for people who can transform a hospital? You look for transformative leaders. And what is the mandate that you give to your leaders? You have to be very precise and very clear and very supportive to your leaders and mention that we have to reinvent our clinical model where we become successful by keeping patients healthy, not by treating the sick. This is called the population health model. Second, you have to correspondingly and congruently evolve the business model where you take the full risk. Because if you start going into population health and you have not evolved your business model for full risk, it is a recipe for disaster. So you have to do both in a congruent fashion. And third is what our industry has not been able to figure out. And whoever figures out will have a lead. All of us have some loved one that got sick at some point of time. And all of us are very educated. And yet we found it very hard to steer through the healthcare system. So the person who will succeed is who will figure out the mantra to deliver coordinated, seamless access to care, closer to home, at affordable price, where the family is fully informed about what's happening with their loved ones. It is a complete transformation of business model. And what we have done, and clinical model. And what we have done is, if you ask me in the last 5 years, for every dollar that we have invested, 95 cents we have invested in this. And I'm talking on more than $100 million in investment. The other piece is you have to read the landscape. The landscape is changing. I know what's coming down the pipe. I know there will be an affordability issue. So the people who do not have access to care are going to use my ER for primary care. Guess what we did? We tripled the size of the ER from 20 beds to 60 beds. So innovation and reading the play is very important. A cookie cutter approach is the most dangerous thing to follow. XYZ is doing something, so I should do it. Every market is different. So that's why my advice will be read your community, read the needs of the patients, and evolve around them, not try to be something that the community doesn't need.
Right, Roger, that's great. I actually want to respond to a couple of things you said. Yeah. First, you suggested that healthcare is no different from other industries, and I don't think you really meant that, because I beg to differ. I work with financially distressed healthcare hospitals, healthcare systems hospitals, lots of nonprofit hospital systems, and I have to tell you that if I'm dealing with a financially distressed shoe store, it might be inconvenient for the buyer who has to go to a different shoe store, but when I'm dealing with a financially distressed hospital, the community cares, the local politicians care, because it is frequently the largest employer in the community. A community without a healthcare provider is not attractive to employers or families. It is a unique space in my experience.
Samuel, you're so right. And what I meant by was that understanding the needs of the customer and understanding the needs of the patient, that's where hospital systems are similar to other businesses.
Yeah.
But if you really see where they are different, we are highly regulated. Another thing I'll give you, we do not have any pricing power. The example that you give of other businesses, if their cost goes up, they can raise the price. My price is decided by someone else. Imagine running an industry in which there is no pricing power, it's highly regulated, and on top of that, the political connotations can also affect you. Well, we are a hospital in California, let's accept it. It's a different environment that we are dealing with. So the industry is very, very different from other industries. But where there is a commonality I meant is you still have to satisfy the primary customer that you're catering to and understand their needs. That commonality doesn't go away. You still have to maintain margins to serve the community that you do. Well, that commonality doesn't go away. But it is a widely different industry. That's why a lot of executives don't migrate from other industries into ours. And that's also a negative.
Asher, your organization accesses people with a severe illness. What are you doing today? What's your organization doing to strengthen care and support? Like, how are you reaching out to the community from your organization today? And perhaps how is it different than it might have been 5 years ago?
For us, we are really focused on earlier diagnosis and universal access to genetic testing and assurances of privacy connected to genetic testing, because many of tomorrow's therapies are, genetically targeted, and we're really focused on clinical trials becoming more accessible. And part of that is, we're happy about the passing of in the House of the Act for ALS Reauthorization Act, which is going to help hopefully continue funding of ALS research and improve or continue access to care and to clinical trials.
Asher,
Yeah.
I'm sorry to interrupt. I just want to, is that a state? You said passed in the House. Is that a state or federal level?
That's federal, but proud to say that our advocates through the ALS network were there in Washington and on the airwaves, advocating for that. And
in today's climate, that's a real success.
Yeah. Well, it's on to the Senate now, so we're keeping fingers crossed there and doing what we can to continue banging on doors. And then, we need to advocate for insurance to keep pace with therapies once they are improved. And scientific breakthroughs aren't going to change lives if the patients can't obtain them. So, innovation and access are going to have to move forward together. So,
Kim, as healthcare continues to evolve, organizations are recognizing that clinical care isn't the be all and end all. What would you say are the investment or changes that healthcare organizations have to make today to better meet people's changing expectations?
I think it's a lot of what we've been talking about today. I think technology is going to play a really important role. It's going to help to reduce administrative burden, automate documentation, improve scheduling, make routine communication between providers and patients much more efficient. All of these changes with the use of technology are extremely valuable to the patient. And I think, from my perspective, what I see as the biggest opportunity in the utilization of technology is that it restores a human element to healthcare rather than replacing it. The goal would be for physicians and nurses to spend less time on paperwork and more time actually listening and directly interacting with their patients. And to kind of go back to what Roger was saying about, and I think all of the panelists, about going from sick care to well care, having more direct interaction with your physician and feeling as if they are really listening to your needs, that's going to help build the trust between those two. It's going to improve, hopefully, patients following their treatment plans that they receive, and this will lead to better outcomes. So I think further, organizations need to be able to make healthcare easier for their patient to navigate. I know we've touched on that as well, making sure that you get rid of all that unnecessary administrative piece and find a way to have collaboration of care so that patients are really getting the best experience and hopefully utilizing their provider more as a resource to stay well versus just being treated for, for diseases.
Great. Thanks, Kim. Roger, many of the challenges we've discussed, from access, patient experience, financial headwinds, closely tied to the payment scheme insurance landscape. What changes are you seeing today, and how are those changes affecting both providers and patients?
I would say, Samuel, this is a question. If you ask any hospital executive, I think you will hear almost 2 hours of monologue, but I'll try to wrap it up. The things are not good when it comes to the insurance landscape, and I'll tell you why. I did mention that government-funded healthcare doesn't cover cost. So employer-based health insurance was kind of cross-subsidizing. And as the pressure on the employer cost increases, the pressure on the insurance companies' margins increase. There are different innovative ways that are coming, and they're using a lot of AI to introduce prior authorization, deny care, delay the payments, downgrade the care that was already provided. And all this, in a nutshell, what it does is it doesn't reduce the cost that you incur to provide care, but it reduces the payments that you receive for the care that you have already provided and after the care has been provided. So it's very, very difficult when it comes to what's happening with the insurance landscape. Now, the way hospitals and the providers have to work is, here is where the AI is going to provide the maximum benefit. Ultimately, the payers are obligated to pay for what the physician documented that they provided care for. The issue with the industry was our own documentation was not up to the mark. So introducing programs that enhance physician documentation and building skill sets to talk to the insurance companies so that you get paid appropriately for the services that you provided are the capabilities and capacities that we have to build, and we are building those.
Great, thank you. Okay, we're coming up to the end of our time, so I'd like to ask you each to give me look into your crystal ball and give me what one change you'd like to see over the next 5 years, and then presumably what your organizations would have to do to respond to that change. And Kim, let's start with you.
I think that what I'd like to see and what we've talked about today is much more innovation and continuing increased collaboration among providers and payers, regulators, technology companies, and the local community organizations. None of these groups are going to be able to solve the challenges that the healthcare system is experiencing alone. It is going to take collaboration and working together to be able to make this a sustainable environment for patients. And what I've seen with my clients is that innovation is being combined is being adapted and utilized in their organizations, but they also at the same time have to maintain strong governance and compliance programs. Boards and leaders are asking tough questions about care delivery and are putting processes in place to make sure that technology is used to innovate while still compliant with federal and state healthcare laws in that highly regulated environment that we've talked about. So I think that's where we're going to see, and hopefully what we'll see is a better patient experience and sustainability to be able to provide care to communities.
Thanks, Kim. Asher?
Well, true to our name, the ALS Network is really focused on creating a more connected ALS ecosystem that brings together care, advocacy, research, and community support. And we are stewarding and expanding partnerships with leading ALS clinics, many of whom are right here in the Los Angeles area, along with researchers, healthcare systems, and organizations across the country. And we're making it easier for people living with ALS and their families to access comprehensive services while helping accelerate research participation. And we've also invested in virtual education, like our Ask Me webinar series, and online communities like ALS Together, allowing individuals to connect with experts and peers regardless of where they live. And ALS is such an isolating disease, and these investments are really about reducing isolation and improving access to reliable information and helping families feel supported beyond the clinic. So, our goal is to ensure that every person affected by ALS has access to the support, information, and opportunities they need throughout their journey.
Thank you. Roger, you get to wrap it up for us.
Samuel, I will say some of the things that I mentioned earlier, and some of my colleagues have mentioned that too. The path to survival is to innovate. Innovate the care delivery model that focuses on wellness. And what you mentioned, Samuel, is other countries are doing better than us. They're focusing on prevention. So that's one. Reinvent your business model so that it is sustainable. Hire smart people that can help you transform. Very essential in the whole thing. And also build a data and digital experience for the patients that they are experiencing in other environments or other industries. That is a basic expectation they're going to have from healthcare providers. And lastly, I will say, and the most importantly, stay focused on your community that you're serving. Healthcare is local. That is very important to understand. It's local, and you have to stay true to your mission. So that will be my recipe for survival in this changing environment.
Thanks, Roger. And that wraps up our program for today. Thank you all for participating. Hugely informative.
Thank you, everyone.
And that wraps up today's roundtable. Yet another great conversation. Sam, Kimberly, Asher, Roger, thank you all so much for reminding us that great healthcare really does. It extends beyond hospitals and technology. It depends and relies on strong partnerships, compassionate leadership, and a continued commitment to the patients and the communities we serve. You all do that each and every day. We thank you for your support. I want to thank our audience for joining in, for tuning in. We hope that you learned as much as I know I did today. We hope that you share this with others in the community who think you'll benefit from it. And we look forward to hosting you again soon. Until then, stay safe and stay healthy.